Welcome to our channel. Selecting the right health insurance plan requires understanding your medical needs and comparing options carefully. Follow these step-by-step instructions to choose a plan that balances coverage and costs effectively. Step 1. Assess your healthcare needs by reviewing your medical history, ongoing treatments, regular medications, and expected medical expenses for the upcoming year. Step 2. Understand the 4 metal tiers. Bronze plans have lowest premiums but highest out-of-pocket costs, while platinum plans have highest premiums but lowest out-of-pocket costs. Step 3. Compare the total annual costs, not just monthly premiums. Calculate premiums plus expected deductibles, copayments, and coinsurance based on your typical healthcare usage. Step 4. Check if your doctors, specialists, and preferred hospitals are in the plan's network. Out-of-network care can cost significantly more or may not be covered at all. Step 5. Review prescription drug coverage by checking if your medications are on the plan's formulary and what tier they're in, as this affects your out-of-pocket costs. Step 6. Evaluate the deductible, which is the amount you pay before insurance starts covering costs. Higher deductibles mean lower premiums but more upfront costs when you need care. Step 7. Understand the out-of-pocket maximum, which is the most you'll pay in a year. Once reached, insurance covers 100% of covered services for the rest of the year. Step 8. Consider a health savings account if choosing a high-deductible plan. HSAs offer triple tax advantages and can help offset higher out-of-pocket costs while building savings for future medical expenses. Don't forget to like this video and subscribe to our channel.